Good morning, everybody. Thanks for being here. I'm Dan Tsai, your director of the San Francisco Department of Public Health. I'm joined here by Dr. Hilary Kunins, who's the director of behavioral health at the department, and Dr. Noel Martinez, who's the medical director of a very exciting program we'll be talking about today. So let me jump in. As usual, on a monthly basis, we're here to report out on the overdose deaths for the month of June. I want to thank the Office of the Chief Medical Examiner for providing us this information and for the work there. And so jumping straight into it, in June of 2025, there were 43 overdose deaths. 43. That is the lowest for this year and is lower than June of 2024, this time last year when we had 49 overdose deaths. I'm encouraged by that, but I want to be clear, we are not satisfied. These numbers also for overdose deaths will continue to fluctuate up and down. And as I've said many times before, every single death from an overdose is preventable, it's unacceptable, and we won't rest until we can materially change that trajectory. As part of what we're doing here in the city and county of San Francisco as the Department of Public Health, we are pulling out all the stops to make sure we can really tackle this problem head on. We want to make sure that folks can access treatment for their substance use disorder much more proactively. We can get people into treatment, including into medication to support them on their opioid and overcoming their opioid use more proactively, more effectively, and more quickly. And so one very important thing I want to highlight today as part of how we're tackling this is what we in the city and county here in San Francisco are doing around making sure people can get access to, in a very innovative way, medication for their opioid use disorder. Particularly, we're going to be talking about buprenorphine today. I think, as I've said elsewhere before, I'm pretty darn proud of what San Francisco is doing on the cutting edge of finding faster, easier ways, including in the middle of the night for people on the street when our street teams are out there, to help people actually get prescribed and get medication to help with their addiction, particularly around opioid use. And a really key part of that is buprenorphine. And based on a number of pretty exciting initiatives we have here at the department, we've increased the number of people that we are serving in the community who are engaged in medication for their opioid use by 70% versus January of 2023, and by an increase of 40% versus January of 2024. Part of that has been driven by a program we launched that Dr. Martinez is the medical director of, where we can, through telehealth on the phone, prescribe this sort of medication to folks anytime during the day or up in the middle of the night as well, and get folks immediate access to that medication. I also want to highlight today, and Dr. Kunins will walk through this, a really exciting piece that we have been implementing, piloting, continuing to innovate and scale up here in the city, which is around using a relatively new formulation of medication to address opioid use disorder through a weekly injectable dose to really help make access to medication easier, more flexible, and also to help people be able to sustain engagement in their treatment over time. So with that, I'm going to turn it to Dr. Kunins to walk through a little bit more of some pretty exciting things that we have going on in the city. Dr. Kunins?
Thanks. Good morning, everyone. I'm Dr. Hilary Kunins, Director of Behavioral Health Services for SFDPH. So we are really thrilled about the work that we have been able to do to get people on medication treatment using buprenorphine quickly and more flexibly. Long-acting injectable medications have been used for many years to treat a variety of illnesses like diabetes, contraception, psychosis, And many of these have been available for years and show demonstrable health benefits in terms of getting people to better health outcomes, in terms of getting people to stay on treatment. These injectable medications are ideal for patients who don't want to have to take a pill every day, experience side effects of a daily medication, or face other barriers to filling and getting their prescriptions. But a major difference in the field of addiction is that injectable medications have really only recently become available. We have been at the health department an early adopter of monthly formulation of the injectable form of buprenorphine as early as 2017. Since then, as you all know, fentanyl has made it more challenging to start buprenorphine treatment and can require several days without using or stopping using fentanyl to start on that buprenorphine, whether orally or in their mouth or injectably. A new long-acting form of buprenorphine, now available, has enabled us to innovate further, and we have been using a new formulation to implement what is called a weekly direct-to-inject model. That means prior to this formulation, people who used fentanyl had to wait a couple of days, including experiencing withdrawal symptoms before they started the medication. With this new formulation that is weekly, the withdrawal period is reduced to minimal or no withdrawal, and that means it's easier to start the medication. So far, our clients are responding extremely well. We are seeing an increase in the number of people we are retaining or staying in care. One example is that in a recent group of patients treated by our BEAM program, our on-demand telehealth program, of 22 patients who received the weekly direct-to-inject formulation, 18 of the 22 went on to continue treatment after that first week. That is really terrific and exceeds what we see in all kinds of illnesses, whether it's pill taking for addiction or other kinds of illnesses. That is really terrific adherence or retention rates. The second shot then is a monthly formulation. So then the patient or client gets transitioned to having to only take a shot once a month, and that covers their treatment, covers craving, prevents withdrawal, reduces their drug use, and they only need to be receiving that once a month. Just to reiterate what we have said frequently, buprenorphine is a life-saving medication along with methadone. It provides people the ability to recover and reduces their risk of dying by 50%. That is a really potent medication and intervention. We want to remind people if you or a loved one wants to recover from opioid addiction or any other type of substance use, please call us. We have treatment options for people at every stage of recovery and many and increasingly flexible options for them to do so. Thank you.
Tal, we'll take some questions now.
Yeah, so for the Brixadi, I know you said 18 out of 22 have opted to continue. How many of them have transferred to the monthly injectable?
So that's all, essentially all of the 18. So they're going on, and for the Brixadi is the new, as you know, the new formulation that is available both weekly and monthly, and also comes in different doses for the weekly medication.
Maggie, did you have a question?
Yeah. So out on the streets, I've talked to some people who are taking buprenorphine or methadone, but are continuing to use, or they've briefly been on the medication, but then stop it and go back to using. So in terms of like thinking about, increasing the number of people who are prescribed this, like how are you measuring success and what are you looking in terms of like providers? Like what do you want to see?
Sure. I mean, the long and the short of it is we want to make sure we're connecting people into treatment. They're getting not only initiated on treatment, but actually successfully continuing. And so to what you raised, I noted one stat before that's very impressive with the huge percentage increase in people we've been able to actually both support and get initiated onto medication treatment. One of the things we're now working on, which is why what Dr. Kunins mentioned is so important, is once you start treatment, especially when we're out in the middle of the night, kind of working with folks, getting them, convinced to start treatment, is whether they stay engaged in that treatment over time. And we absolutely see many people continue. And we also see folks that over the course of days and months don't continue. Some of that is because without the monthly injectable, you have to continue to go to the pharmacy to pick up additional doses. There's a lot of stuff that has to happen. Being able to move to a monthly injectable removes many of those barriers, and by definition, gets someone adherent, as Dr. Kunins said, to medication for a 30-day period. That's why we think this is so powerful, and the direct to inject protocol that Dr. Kunins mentioned helps to overcome some of the historic challenges of being able to do a 30-day injectable to be able to do this. But anything you want to add, Dr. Kunins?
Thanks. And that is a great question. In addition to what Director Tsai said, I want to just comment on a few things we are doing to increase people's retention and care, as we call it, keep on coming back. We are using strategies like our patient navigators, our night navigators. We are using in some sites a method we've talked about for stimulant use disorder, contingency management, incentivizing folks to come back. We are taking a very proactive approach across our clinics if people are not returning to care to get them to come back. Last point I just want to make is often the folks who perhaps you might encounter on the street who are continuing to engage in substance use are sort of only a part of the patients we're seeing. Some of the folks who are exiting, finding shelter, finding homes, stopping drug use altogether may not be visible as you are moving around the street. And there's many success stories there that it's also important really to highlight.
Do you have a follow-up question, Tsai?
It's a different question.
Sure.
27 people overdosed in Baltimore earlier this week on a new fentanyl combination in Jack City. Has this been popping up in San Francisco yet, or is it still primarily on the East Coast?
Not yet here in San Francisco. I should say not say that. No, here in San Francisco. The rough distribution of the overdoses and the particular substances leading to that have remained relatively constant and consistent, but it's something we're watching very, very closely. As I've also noted, we're, I think at this time last month when we announced last month's overdose numbers, we also talked about additional treatment options. Contingency management is the technical term for that help with treating stimulant use disorder for methamphetamine use, for example. We want to make sure we have effective treatment options across the continuum, regardless of what substance someone is taking, because we are concerned about all of the overdose deaths.
One more? Okay, great.
Okay. The weekly injectable, is that available through like the Night Navigator program and whatnot, or also Maria Martinez? Is that like?
Actually, Dr. Martinez.
Thank you. So yes, it's available across our health system. Our community, our DPH pharmacy, CVHS pharmacy helps supply our injections across our system. And so it's available right in 1380 Howard. Someone can walk into CVHS pharmacy and ask for it. And our BEAM team, can give it to them that same day. And then the injectable is also available at Maria X Martinez, through our shelter health partners, permanent supportive housing partners, jail health, Bridge Clinic, OBIG Clinic.
Everywhere
Yeah.
across the department.
Yeah. Okay.
Great. Thank you all.
Your own private press conference.
Thank you all. Take care.
Thank you.
Thank you.
Thank you.